Hey guys, this is Dr. Tran from VietMD.net. So today we will talk about pharmacy in a very informal way. Or as you can see, we sit in a medical campus at a medical school in Southern California right now, not in our uniform. Next to me is Victoria Nguyen. She is a pharmacist at a large retail pharmacy store in Southern California. Hello, Victoria.
Hi, Dr. Tran.
Nice to see you.
Nice to meet you.
All right. So, can you tell us about yourself?
My name is Victoria. I have been a pharmacist for 3.5 years. I work at a big retailer chain here in the U.S. Called CVS Pharmacy.
CVS Pharmacy.
Yes.
Okay. Well, so why did you pick pharmacy as a career?
Well, originally I actually wanted to go into medicine because I love that patient care interaction, making an impact on our patients' lives. Right when I was about to go to college, my parents, they told me to take a look into pharmacy school, which I did. And I found it very interesting because as pharmacists, we can make an impact on our patient care through other ways, such as making sure they take their medications on a daily basis, making sure the things that they take don't interact with other medications that they're taking. So it's very important.
Wow. So, as a pharmacist, you did make an impact to a patient life every day. Now, so what are the pros and cons for retail pharmacy? Because many pharmacists, they pick either clinical route to become a clinical pharmacist, or they go to retail. So can you tell us what are the pros and cons for retail pharmacy?
Yes, sure. I would say let's just start with the cons first.
Okay.
Because I think the cons are not along the list.
Sure.
With retail pharmacy, it can be very busy in a stressful environment. I would say that might be the con. Also, sometimes dealing with difficult or impatient customers. But overall, I would say retail, in my opinion, it's more of a rewarding, career field because as much as I value and I respect clinical pharmacists, they make clinical decisions with other healthcare providers on deciding what medications to start for their patients. But for retail pharmacists, we do make an impact where we follow up through with our patients, making sure they stay compliant with that. And we do have their medication list, so every time before we dispense a medication, we make sure there's no therapeutic duplication or interaction with the other medications they're taking. So I find that very important.
I see. Well, so one of the things is people are concerned when they go to pharmacy, just like everyone concerned, is income, salary. Is there any difference between retail pharmacy versus clinical pharmacy?
I don't think there is a huge vast of a difference. There might be some, but in terms of average salary, we do make around the same. It just depends on, obviously, what kind of employer, company, institution you work for, especially the location too, where you reside. So, but overall, it's about the same. There's not much of a difference.
I see. So the U.S. Average salary for pharmacists this year is about $100,000 to $120,000 a year. So that's roughly the ideal number national. Now, when we talk about pharmacy and retail versus clinical, the other thing that become a trendy recently is provider status. Right? I'm sure you heard about that. Like pharmacists
Yes.
become a provider, like you become one of us. What do you think?
I totally support that idea, actually, because I feel like pharmacists do make an impact for our patients. Sometimes patients don't always have access or the time to see their healthcare providers. So as pharmacists, we have all the information, what medications they're taking, whether it's over-the-counter or whether it's prescription. We can make clinical advice. When we went to school, we learned all of the therapeutic knowledge, the guidelines on how to treat and start medications, just like a medical doctor. We also provide vaccinations, and vaccinations is very important for our patients to prevent especially if they have certain comorbid conditions, they need to be protected in our community.
So as we're speaking, and this is 2015, so what a pharmacist can do as a provider in Southern California, you say give them shot vaccination, right?
Vaccinations is one of them, and there's something that there's a field in pharmacy called medication therapy management, MTM services, where the pharmacist will take the time to sit down with their patients, go over the medication list, make sure they understand how to take it, they're compliant, probably discussing if there's any other alternatives, maybe to help save money or something that might be better for them in terms of their treatment plan.
I see. That's very interesting. Well, so since you are a manager, and now you want to move to the next level as well.
Hopefully one day.
So the question is, when you are hiring a new pharmacist, what are the characters you're looking for? Because many pharmacists from VietMD or in the US in general, their question is, when they apply to CVS, what are the characteristics that you guys as manager looking for?
To me, if I were to look for a candidate for the company, it's, I would say, compassion and motivation.
Motivations?
Yes, because with the setting that we work in, we're always interacting with patients, whether it's in person or through the phone. So I feel like it's very important to have that quality, to have that patience and that empathy to make sure and understand that our patients understand how to take their medications, but also we need to understand in their shoes that they're going through a tough time right now, they're sick, so whatever they say or behave, we can't take it personally. That's why we're here, to make sure their quality of care is taken care of. I would say drive and motivation, because I would say CVS is a very innovative company. We're always looking for better ways to improve patient care, whether it's reminding their patients to stay compliant with their medications, making the process easier for picking up their medications. So I feel like for an employee to work with CVS, you would have to be willing to accept changes and improvements what we're going to do for our patients and for our community.
I see. So you mentioned the characters. What about pharmacy school? Do you guys care what pharmacy that candidate went to, or any pharmacy school would be okay?
I think as long as it's accredited pharmacy school, they provide the correct, education, the basic standard education for you to be licensed as a pharmacist. That's the most important thing.
So that brings me to a very interesting question. Did you guys ever hire international pharmacists? A pharmacy graduate from a pharmacy school outside the US?
I have seen that, actually.
Oh, you have seen that?
Well, I have interviewed and I've seen and worked with people who graduated from pharmacy school outside of the country, and when they move to the U.S. and they want to practice in the U.S., they would have to get a certain amount of experience in the work setting. So they would actually apply as a technician, and they would work for a certain amount of hours, I would say probably for like a year or 2 years, depending on the time frame. So they get enough of that experience, and then they study for the board examination to get licensed here.
So it did happen.
Yes, I've seen it.
For those graduates from a pharmacy school out in the U.S., but it sounds like they have to go additional training or clinical hours before they can take the board to become a licensed pharmacist. All right. So one last thing, any advice for students would like to, actually 2 more questions. One is your advice for a student who would like to pursue a career in pharmacy. What would you advise?
I would definitely support the idea if you want to go to pharmacy, if you're passionate about patient care and interaction. It's very important. If you don't have that connection where you want to help people improve their health or their life, then I don't think pharmacy will be the right career path for you.
I see.
Yes.
So one question that many people actually concerning is the job market for pharmacists in Southern California. Can you comment on that?
I would say it's a little bit saturated right now in Southern California, especially how the U.S. is opening a lot of new pharmacy schools out there. It is a little bit tough, but I think with the right networking and the drive, the hard work, eventually you'll find something.
Okay, so networking, motivations, and hardworking will find you hopefully a spot in a very competitive market in Southern California in pharmacy. All right, thank you guys. Thank you very much for watching.
Thank you for having me.
No, thank you, Victoria, for a very good insight about retail pharmacy. And if you have any questions, you can follow us on YouTube or Facebook. Thank you.
Thank you.
Thank you very much.
Bye.
Bye.